Alright, welcome back to Talking Tech. Excuse the very small desk, we are shuffling a few things around, but we're back in the studio, trying to make the studio better than ever, better than my room. So today we have a really interesting thing to look at. It is essentially just an ultrasound therapy machine from Revitive, Revitive, I don't know how to say it, but that's the brand. Now, essentially, they say this relieves pain and speeds healing. Therapeutic ultrasound relieves muscular pain and supports healing. So a lot of physios, doctors, surgeons will have this sort of product that they use on patients, and it's supposed to just encourage healing, basically aid a whole range of injuries that might get you back on the field sooner or later, quicker. So what they say is for muscular injuries, aches, pains, and strains, designed to relieve pain and aid healing. So on the back, they say it's targeted and effective pain relief, muscular injuries, sports injuries, aches, pains, whatever the sport. What is the ultrasound? It's designed to relieve aches and pains. They say that again. It's a range of settings. You're in complete control. So how it works. So therapeutic ultrasound technology, widely used by physios, is a very high frequency sound vibration. So it cannot be so high it cannot be felt. That stimulates tissue up to 4 centimeters beneath the skin surface. The movement and vibration of cellular fluids causes changes in membrane permeability and the movement of essential ions and nutrients into and out of the cell to aid repair. So basically it aids the healing process to help you get you back on your feet. Now, I have been using this for a few years. This is a new one that I had just gotten and thought it would be good to unbox it and talk about how it's been for me over the last few years. Now, the really good thing about this is it's actually very affordable. It's only a couple $100 and it uses the same frequencies that a much more expensive device would do, such as the ones that they have in physios, in surgeons' rooms, and so on. And I actually found that out from my surgeon who had given me his device before I'd gotten this. And this was a few years ago. And essentially it did exactly the same thing as this, but that one costs over 5 to 10 grand. And we looked at the specs and the frequencies were exactly the same. So what this was doing was exactly the same as the really expensive one that the physios, surgeons, and doctors are using, which was very interesting. And I think that's a good point to note in that I'm not saying that this is gonna fix you. I'm not a doctor, I'm not a scientist, I'm not a physio, but some people don't believe that this does anything. There's a lot of controversy around it. You can look into the study yourself. But for me, it has worked, and that's why I am doing this video to show you what it is about. So basically, the model is the UT1033. There's a low, medium, and high settings. Frequency is 1 MHz, megahertz, millihertz, I don't know which one that is. Power supply, 18 watts. Effective intensity, 2.4 W per centimeter squared. I don't know if that is a watt or whatnot. Warranty, 2 years, and then you've got your duration. So we get right into it. It was called Ultralieve, which was the formerly Ultralieve. That was the brand that I had before. But now Revitive has taken over by the looks of it. So we've got the user manual, which country distributors, you've got Australia, New Zealand, international, and UK. Okay, and these guys are really good because I had an issue with my old one. Revitive, I sent it in, they sent me a replacement, and this was within the 2 years, which is great. So I am very thankful for them. So their support is great. Now it just tells you instructions, how to plug it in. I will explain it. Now, low power, it says for the depth of injury in centimeters is 0.5 to 2 centimeters. Medium power is 3 to 4 centimeters. And then we've got chronic or an old injury. High is higher than 4 centimeters. And you can do it for 2 minutes per treatment area. If the treatment area is 8 centimeters squared and the symptom is chronic, according to the table, the treatment time should be 3 minutes. Although I've used it for much longer than 3 minutes. And there's just other information in here. It is IPX7 for the head, so you can get a little bit of water just to clean it. If you've got a little bit of ultrasound gel that's sitting there and might get a bit stagnant, you can just sort of put a bit of water on a tissue, is what I do, and wipe it just to get rid of that stickiness. So straight in, off the bat, you've got your ultrasound gel. Now this is very small. I would advise to just go on eBay and get ultrasound gel. Any generic ultrasound gel would work because it's the same thing, it's the same product, just the blue gel. So once that runs out, just go on eBay and get normal ultrasound gel. Here we have the AC adapter, which is Australian, hooray. And we have a little carry case, cool, I like that. Then, put the charger back in here because we don't need it. We have the main device. Now you got to plug this into the power adapter to operate it. The one recommendation I would have for the Gen 2, if that's what they're going to call it, the next one, is to have a lithium, like there's a lot of space in here. Put in a lithium ion battery, make it rechargeable, and then make this wireless. And sure, you might be able to charge a bit more for it, but that would make things a lot easier for anyone using this. But so far, this is what we have to deal with, which is just plugging it in and using it that way. I actually had a few issues with the cable, but after a few years of use, that's why I got the replacement. But it seems to be fairly sturdy, and I did use it a lot. So on the front is your on and off, and this is how intense it is, from low, medium to high. So you just click the light and the blue light will pop on whether it goes low, medium and high. And then you have your timer, 5, 10 and 15 minutes, which you just click and it'll just go again, another blue light. So you can go basically 15 minutes at medium intensity. And the aim is to basically put a finger of ultrasound gel, put it on this silver part here, and then essentially just start going at your injuries. So what I found was that if you've got, for me, so this isn't going to be for everyone, so take this with a grain of salt. I wouldn't put on injuries that need to be iced. So I would ice my injuries. Let's say I just got an acute injury. I would ice it for 3, 4, 5 days. And then afterwards, when it's time to start heating, that's when I would use the ultrasound therapy. And sometimes, you know, let's say I've got a stuttered during football, I started on my leg, ice it for 3, 4, 5 days, and then maybe after a week, start heating it. And that's when I would start doing this. And although it does recommend to do it in small doses, 2, 3, 4, 5, 10 minutes, if you go over that, it's not the end of the world because it's just ultrasound therapy. It's just going to go into the leg and help recovery. It helps for mostly muscular, but I have done it on a few acute bone injuries, such as on my foot, on my groin, my knees, my arms, hands, wrists. I've had a lot of injuries and I've tested this a lot, and it does help if you use it in that sort of later recovery stage, because you'll be able to put it on and you know when it needs that heat. This actually, you can't feel much, but it does get a bit warm after 5, 10 minutes, which I don't know the science behind it. Maybe it's just the sound waves, whatever, but it does help. You can sort of feel that heat on the injury. So again, I'm not a scientist, I'm not a physio or doctor or anything, but for me, this worked quite well in the later process of the recovery, and it just sort of sped up the recovery a bit. I can't put a number on how much it sped up recovery or, you know, how much time it took off, but it did definitely help in that stage where I'm up to heating. And, you know, I've had a few groin injuries in the past and it's helped with that as well. So overall, it is quite good. And the thing is, it's so affordable. Like I mentioned at the start of the video, it is so much cheaper than the ones that you're gonna get from the one that you see at the Physio. They've got the big machine. They're working on the same frequencies, and those are just crazy. You don't need to go to the Physio. Essentially, you just take one of these, especially with the massage gun video, which I did before. That can be your physio's arms, and this can be your physio's ultrasound therapy, which is really good. So I would recommend it. I would recommend getting other gel once this runs out. I do like this little thing here. There is a lot to like here, and if you are active and you're involved in a lot of sports like me, this is definitely something that you should have, because as soon as you get injured, do the icing right away. That's what you should always do. Rest, ice, compress, elevate. And then after that initial phase of icing and resting is done, then it's time to start using this, where it can speed up the recovery. For example, if you've just been stuttered, it might be 3-4 weeks. If you've got a bad bone bruising, this can help it. Now I'm just going to check what they say here. Muscular pain and supports healing. So they mention muscular injuries, aches, pains and strains, which it does help with. If you've got even some tendons or ligaments that are feeling a bit tight, just put it over. You probably will need a fair bit of gel the bigger the area it is. You might need to keep reapplying. Let's say you've got a quad injury, which is a big muscle. You're probably going to put a few bits of gel to keep reapplying to keep it smooth, which will run out shortly because this is only 85 mils. So I went online and got those 200 ml bottles that they use in hospitals or at radiologist, radiographer, rooms, and that lasts way longer, so you don't have to be obliged to go back here. But anyway, there it is. I am impressed with it. I've been using it for a while, otherwise I wouldn't be speaking so highly of it. I've been using it for a few years. So it is quite good, and it does help athletes out just to get them back on their feet a lot quicker. So there's our little review of this. Something different, not your usual tech products, but something that some people could use, and I wanted to do this because I know it can help a lot of people. So I hope this was of some use. It's helped me a lot over the years, and I hope you enjoyed the video. Thanks for watching if you've made it this far, and don't forget to like, comment, subscribe, all that usual stuff, and stay tuned for more videos. And let us know if there's anything you want us to review. We'll see if we can get our hands on it. Don't suggest things that are stupidly expensive, because we're probably not going to be able to get our hands on that, but we'll do our best. So anyway, stay tuned. Cheers.